Well, good morning, everyone. Thank you, Jennifer, for that. Before I get started, Jennifer is very, very humble. A lot of this work is because of her, so let's give her a round of applause. So for a little self-disclosure, I do have a Twitter account. I have, I think, retweeted one time, and I have no idea how to use it. So I'm probably in your sights. I did actually connect with Dr. Frieden, and whoever does his tweet, I mean, he's a very prolific tweeter, so maybe I can learn from him. So this meeting is really great. I am so impressed with the number of folks that actually find the time out of their busy schedules to come, and particularly these days with all of our funding, so many of us have tight funding restrictions. So it's an honor to see that this meeting is meeting the needs of folks. And when we are out and about, we do also try to meet with some of our Public Health Institute members. And so yesterday, Sarah Gillen and I had some time with the University of Washington, the School of Population Health Improvement over in Madison. Really, really good folks in the network. And there's about over 4,000 staff in the network and all the agencies in the network across in the public health institutes. And so it's really fun to get to know the work that's going on and the collaboration between the institutes and the health departments and the tribes. It's really powerful to see. I can remember back when I was at NACHO, and I know there's a lot of NACHO folks in the room. It's always great to reconnect. And the earlier IOM reports were coming out. Those reports really were setting the stage for a lot of this work. And we used to have that expression, if you've seen one health department, you've seen one health department. And this whole process obviously is moving that very much forward. 9/11 really was very sad because for all of the reasons of it, plus what it did to public health, I think in some ways, while we advanced in emergency preparedness, I think it set us back in other ways. There was that IOM report that came out before 9/11 that was really good, and it just really, we didn't have the opportunities that we do now, so it's really a great time to be in public health. It's a tough time to be in public health because in some ways we've been enormously successful with sort of a health and all policies movement, but that also means that things are harder to track, things are harder to fund. I was recently on an advisory committee with HUD in D.C. They convened a national advisory committee to give them advice on how to create health through public housing formulas and approaches, and they're building a tool to help communities sort of step through that process. And it was a fascinating couple of days to spend, and we actually went through a whole series of indicators, and there's a lot of opportunity for QI work to even be injected in that. And Wisconsin, by the way, is one of the states that is helping lead that initiative. So in a few years, we might actually have, well, maybe less than 2 years, we might actually have a new tool that we can all use as we look at, building health through housing. So we do see all of these opportunities, and QI and the accreditation process is really all part of that long-term journey. So it's an important body of work that is leading us to new practice, and so I commend all of you in this room for helping us do that. The recent Trust for America's Health Report, 2013, Strategies to Move from sort of a sick care system to a health care system in the next 4 years, stresses the need to strengthen the role of health departments as what is called chief health strategists. And it's an interesting term. And what this means is integrating with healthcare providers. It's not so much integrating medicine and public health, but integrating the functions in a better way. I mean, we do see a lot of opportunity, and I know for those of you who were just at the NNPHI conference, we had a lot of sessions and a lot of discussion about that. I know the NACHO conference coming up in the summer will as well, and I'm sure a lot of your conferences. Also partnering with non-health sectors like education, transportation, and I already mentioned housing and others, and so that's an ongoing piece of work that does relate to all of the work that you're doing. Utilizing modern technology to help top health problems. There's a lot of technology fixes for those of us who are slow learners. We can come along in that process, and people create systems. I mean, we need the systems that you are all developing, but people create them, and so we've got to figure that crosswalk out, and particularly with the workforce. And so with the younger workforce coming up, obviously their technology skills are really excellent, and so part of the QI process, part of the accreditation process, should be integrating more and more technology, and we are seeing that. And finally, defining and prioritizing a set of what is called foundational capabilities for public health departments at all levels of government, including the tribes, that are needed to protect basic public health. And so the report calls out accreditation and continuous quality improvement and transparency as all very important parts of ensuring that these foundational capabilities are met and maintained. So all of that is a way of saying that we at NMPHI, all of us, commend the work that you're doing. We are glad to be a partner of yours in this journey. It's a lifelong journey, and we look forward to this next few days together. It's my honor actually to introduce the next three speakers, and I'm going to introduce all three at once, and then folks can come up. The first is Karen McHugh, who is the Public Health Division Director at the Wisconsin Department of Health Services. Karen has extensive experience in health policy and the healthcare industry. She's an oncology certified nurse and a certified hospice and palliative nurse. She received her Master's of Nursing with honors in nursing management, policy, and leadership from Yale, and her BS of Nursing summa cum laude from the University of Texas at Tyler. And she recently served as a graduate fellow in health policy at the Heritage Foundation. It's an important experience. And was appointed stationed at the U.S. Senate Finance Committee. So Ms. McHugh's policy work includes extensive research and authoring white papers on rising healthcare costs and healthcare economics. So welcome, Dr. McHugh. We also welcome Dr. John Raymond, who is the senior medical, is at the Senior Medical College of Wisconsin. He is the president and CEO. He assumed his position in 2010 and came to the medical college from the University of South Carolina, where he served as vice president for academic affairs and provost. He is a practicing nephrologist who plays active roles in clinical care, teaching, and faculty mentorship. And Dr. Raymond is also a medical researcher studying the basic mechanisms of kidney cell function. He has served on editorial boards of 3 major medical journals, and he has been awarded many honors for excellence in leadership, research, teaching, and clinical care. So welcome, Dr. Raymond. And finally, Linda Helmlick, who is the health administrator for Forest County Potawatomi Health and Wellness Center. And Linda is the health services, the health division director for the county. She also serves as the secretary of the Wisconsin Tribal Health Director Association. She has 25 years of experience in a broad range of healthcare settings, including holding a master's degree from the University of Wisconsin-Madison. The past 13 years she has spent growing a tribal clinic in an accredited comprehensive health system which supports the continuum of care needs for the Potawatomi tribal community, as well as the ambulatory health care needs of non-tribal communities in 5 county areas in northern Wisconsin, so it's quite a job. Their system includes integrated patient-centered services and ambulatory care, in-home care, long-term care, telehealth, and public health. And she is a strong proponent of public health and its essential role in developing this public health system and protecting health. So we welcome them, and we're honored to be here with you.
Good morning. I am honored and delighted to welcome you to Wisconsin, and I want to just say I hope you've taken a few minutes at least to experience some of what our state has to offer. What an exciting time to be working in public health. 2 movements, quality improvement and accreditation, are giving us an opportunity to take a fresh look not only at what we do, but how we do it. And I do want to take a minute to thank NNPHI for their leadership in both of these areas. At the State Division of Public Health, We are in the process of working toward accreditation. We aren't there yet. And we're also trying simultaneously to support the local health departments and the tribal health departments in their journey as well, and trying to figure out ways to, not only to support them, but to reward those departments that do achieve accreditation. There are 14 health departments accredited nationwide, and I am really excited to tell you that 3 of those are in Wisconsin. We are so proud of those leaders, not only for their success, but for their willingness to help all of their peers in their journey. So we look to them as we take our next steps as well. Our Secretary of Health Services, Kitty Rhodes, has a motto: we're all in this together. And nowhere is that more true than in public health, as we work together as state, local, tribal health departments, and all of the other organizations that are working toward public health. And I also want to thank Nancy Young and the Institute for Wisconsin's Health for your leadership also and partnership on quality and accreditation. So you have a packed agenda today. I'm really excited. I'm confident that we'll all take away great ideas for next steps, and I'm looking forward to it. Thank you.
Good morning, everyone. I'm pleased to be here to represent the Medical College of Wisconsin. And Chad, I've tweeted twice already today that it's not that I was so prolific, but the first time I was thumb challenged and called NNPHI, NNPI, so I had to correct it in the second tweet. If there's a way to correct in retrospect a tweet, you can tell me later. It is an honor to share the podium with Karen and Linda, and I have visited the Forest County Potawatomi Community Health Department, and they're doing incredible work there. So it is a true honor and a privilege to work with the Potawatomi Council. This event here today, I think, is very important, and the topics that you are covering in terms of quality improvement and working at the interface of medicine and communities is truly critical. You represent the nonprofit organizations and public health leaders that improve public health, serve as a moral compass for healthcare providers, for government agencies, and for policymakers. Now, at the Medical College of Wisconsin, we also believe in the continued integration of medicine and public health, and believe that's important for us to continue to serve our mission here in Wisconsin. Today, at the Medical College of Wisconsin, we teach students to focus on the needs of patients in a population health model, focus on quality service and value. And in 2015, we're going to open campuses in Wausau and Green Bay with a new curriculum that will focus on prevention, wellness, the IHI triple aim, and interprofessional education. And we're going to try very hard to incorporate all the concepts of public and community health into that curriculum. So I do want to comment, as a medical school, we do feel a strong commitment to public health, and I think that's best exemplified by our Institute for Health and Society, which is led by Dr. John Moyer, who also will be moderating a roundtable later in the meeting here. Our initiative that he's going to talk about will be used as a model for achieving the IHI triple aim in healthcare prevention and wellness to improve the experience of patient care and management of populations and reduce the per capita cost of both prevention and health care. So we do take our public health responsibility very seriously. As I mentioned, we have the Institute for Health and Society. 3 years ago, we converted the Department of Population Health into the Institute for Health and Society to reflect the increasing role and importance of public and community health to being a modern medical school. The Institute's mission is to improve the health and advance health equity through community and academic partnerships, and we are truly committed to the partnership model. The main goals of the Institute are to contribute to innovative programs of value in population health management and patient care, to discover and translate new knowledge in the biomedical and social sciences into community health improvements, to bring advanced knowledge of the social determinants of health to our medical school and to the state of Wisconsin, to educate and develop the next generation of scientists, physicians, and public health professionals, and to develop and sustain those academic community partnerships that I mentioned were so important to us. So again, I want to thank you for being here in the beautiful city of Milwaukee and the great state of Wisconsin today. Thank you.
McHugh, good morning. Welcome to Wisconsin. Wisconsin is also the home to 11 Native American tribal nations. I'd like to thank Dr. Raymond for the kind words about our program at Forest County Potawatomi, but I'd like to share with you today the other amazing things that are going on at all 11 tribal nations. In some ways, I think tribal health care is probably one of the best kept secrets with regard to health care going on within communities. As the secretary of the Wisconsin Health Directors Association, I'll fill in today. Jerry Wakaw, our president, who represents the Menominee Nation, was unable to be here, so I have the privilege of being able to speak with you today. I'd like to introduce you to the names of the 11 tribes in the state of Wisconsin. And I do that because it's important to understand as tribal nations we're individual and unique. And it's a common mistake to lump all tribes together, but it's very important to understand, like any community, there's various differences, some commonalities, but definitely unique traits. The Bad River Band of Lake Superior Chippewa Indians, Forest County Potawatomi Community, the Ho-Chunk Nation, the Lakota Band of Lake Superior Chippewa Indians, Lac du Flambeau Band of Lake Superior Chippewa Indians, the Menominee Indian Tribe, the Oneida Nation, Sakagan Chippewa Community, St. Croix Chippewa Indians, the Stockbridge Munsee Community, and the Red Cliff Band of Lake Superior Chippewa Indians. Many of you may be unfamiliar with the blended service models that exist in tribal healthcare systems. These models are models that take advantage of integrating clinic-based care with community-based care and education, truly a blending of ambulatory care and public health. Much the same as the nation is moving with healthcare reform, blending models, blending agencies for the betterment of our patients. While all of our tribal systems reflect the uniqueness of the tribal community that is served, there are a few strong commonalities. And many of these commonalities are topics that you will be hearing about through the next 2 days at this conference. One is accreditation. The Ho-Chunk Nation, Stockbridge Munsee, Menominee Indian Tribe, and Forest County Potawatomi Community all maintain HHC accreditation and have for many years. The Menominee Tribal Clinic and the Forest County Potawatomi Health and Wellness Center are the only two HHC accredited medical homes within the state of Wisconsin, and that are tribal clinics and non-tribal clinics alike. We view accreditation as a pathway. This pathway leads to sound system development, database decisions, and the delivery of quality health care. My colleagues at Forest County Potawatomi, under the leadership of Lorrie Shepard, are heavily involved in working towards public health accreditation. You will have the opportunity to listen and learn from Lorrie a couple of times during this conference. And secondly, community health. Each of the tribal health systems has a community health component. This is our public health component, but mostly referred to as community health. This is a blend of home health and public health under one umbrella. These departments excel at knowing their communities and its needs. They are key to prevention and education within the communities. They are trusted healthcare providers for the people that we serve. They have strong educational programs that target all ages, similar to many counties as well. Some of these programs include prenatal care and the benefits of breastfeeding, car seat safety, youth hygiene, youth on the move, diabetes programming, healthy eating, immunizations, just to name a few. And finally, integrated care across the continuum. Case management from primary care to in-home care to long-term care. As an organization, the Wisconsin Tribal Health Care Association is working closely with the State of Wisconsin Department of Health to work our way through various models that would be of most benefit to the tribal nations of Wisconsin. And many of these models look at the importance of the medical home as well as the importance of integrated care, efficiencies, as well as being patient-centered. Several tribes have participated and implemented a specific model of care that builds care around care teams and the patient. This patient-centered approach helps the patient navigate through complex health systems that they must travel. all in an effort to have primary care teams as the central support team for the patient, but expanding those primary care teams to have members of public health or community health on those care teams as well. What a better way, or not a better way exists to help our patients than to be able to extend what they've learned in the physician's office into the community health setting. Visits are pre-planned to assure that prevention, screening, and education occurs per the national recommendations, as well as the individual specific needs. Skill levels of each team member are maximized to allow each member of the team to focus on the skills that they were hired for. Physicians do medical care. They don't push papers. Nurses work with the patients. I could go on and on about the great things happening in each of our tribal health systems, but I know you have a full day ahead. And you'll be able to learn many, many things. So I encourage you to seek out any of our tribal participants if you have curiosity related to the models we use and the unique care systems we implement. Enjoy your conference. Thank you.
Karen, John, and Linda, thank you so much for that. Welcome to your state. One of the best kept secrets of the Affordable Care Act is probably that the Indian Healthcare Improvement section was permanently reapproved. And I remember I had the pleasure of doing a sabbatical with the National Indian Health Board and supporting some of the tribes as they were beginning to talk more about public health, even though they were really doing it already with a more integrated approach. And the fights on Capitol Hill were pretty ugly at the time, and so I'm really pleased that we finally have that part of our history behind us. And there's a lot we can learn from the models. So it is my pleasure right now to introduce Nancy. The state of Wisconsin has used an impressive collaborative approach among key partners to advance readiness for accreditation and quality improvement capacity in a relatively short period of time. The high numbers of Wisconsin attendees at this event is not just because we're in the state. We've been to a number of other states, as you know, and we see high numbers of participation because they are trailblazing in the path to accreditation. To tell us a little bit more about this, Nancy Young is going to introduce her team and talk to us about their great experience. Nancy is the executive director of the Institute of Wisconsin's Health Incorporated. She here is an independent public health institute, and we'll hear a little bit from the other member institute in Wisconsin later in this conference. The Institute for Wisconsin Health exists to strengthen Wisconsin's population, entire public health system through capacity building and innovation. She was the co-director of Wisconsin's Public Health Quality Initiative, funded by RWJ as well, as part of the original multi-state learning collaborative, which many of you were part of. The Institute continues to support tribal accreditation, preparation, and quality improvement efforts with funding from the National Public Health Improvement Initiative Award administered by the Wisconsin Division of Public Health. And Nancy is a past president of the Wisconsin Public Health Association, and she's also the owner of Gray Horse Consulting, a private strategic planning and evaluation firm based in central Wisconsin. And I am also told Nancy, not coincidentally, owns 3 gray horses and 1 gray dog. So welcome, Nancy.
And not coincidentally, I'm graying day by day also. Good morning, everyone. Very pleased to be here. Very pleased to have you all here today. The satellite image on the top here is, taken of our state on a day like this. The satellite image on the bottom is the remaining 10 or 11 months of the year. Therefore, it has been a little bit difficult to get you all to be here in our state, but we're very pleased to have you. We hope you have a great time. Thanks to Karen, John, and Linda for their opening comments as well. We want to now quickly, I'll tell you what we're up to. We want to provide an overview of our progress to date for you using 4 authentic voices, and those voices are right here. we thought it would be interesting for you to hear from people who are walking the talk. And so from left to right, Gretchen Sampson, who is the Health Department Director at the Polk County Health Department, recently accredited. Yay! She's a cheerleader, so she will lead cheers later. Linda Conlon, the director of the Oneida County Health Department, who is the immediate past president of the Wisconsin Association of Local Health Departments and Boards, and she'll be wearing both of those hats kind of today when she speaks with you. Lorrie Shepard, who is the community health supervisor at the Forest County Potawatomi Healthcare Center, and Angela Nimsgern, who is the Northern Region Office Director for the Division of Public Health. Very quick overview of our system so you know where we're coming from. Wisconsin is a decentralized system. We have 88 local health departments and 11 tribal health departments. It's a mix of models and sizes and services. Most of our health departments are relatively small in our state, so we think that other states with that type of alignment may have particular interest in what these folks have to say. There's a Department of Health Services located in Madison and a Division of Public Health, which Karen leads. And then there are 5 regional DPH offices that support the locals and tribes. Wisconsin is a home rule state, so decisions about whether or not to pursue accreditation are locally made. We have a history of both community health assessment and planning and also levels of health departments that are grounded in statute and rule. You'll probably hear a little bit more about that. As Karen mentioned, we do have 3 of the nation's first 14 accredited agencies, and based on a survey that was done this spring by DPH, there are at least 21 health departments in our state who have already applied or who plan to apply for accreditation by 2015. Job security for the fab folks in the room. And I say at least because the survey that was done this spring had a response rate of 76, so about 75% responded. Others who did not respond to the survey may have been too busy uploading documents. We don't know. So what we're trying to do, and what I think we are doing, is sustaining the community of practice that began with the Robert Wood Johnson funded Multi-State Learning Collaborative for us in 2008. We've come a long way in a short time, and we think it's because of this partnership, collaboration that we've been able to pull off. I think we don't just talk about working together, we do work together and encourage one another. First, the strong local and tribal health department leaders are absolutely critical. Our public health institutes have been part of the progress. The Department of Health Services that has secured funds, and not only secured them, but then offered them back to the locals and tribes who are actually, charged with making these changes. And then, of course, our national partners and funders. So that's been responsible for our success so far, and these folks will be able to tell you more about how that works. We'll welcome your questions after after all 4 of the speakers are done. So I'll hand the microphone to Gretchen Sampson.
Good morning and welcome to Wisconsin. I'm going to talk a little bit about Polk County Health Department's journey towards accreditation and hopefully inject a little fun into the conversation because, gosh darn it, this has been hard work and it's really a journey, but at the end of the road, lots of celebration to do. This was us in the beginning when we kind of started our journey towards accreditation. Like, what the heck is all this fab stuff? I mean, we looked as dazed and confused as W in this picture, so we thought there was only one place to go, and that was up. The typical early response from my staff when people would ask them, okay, so why are you subjecting yourself to this kind of torture was, the boss made us do it. But in reality, that's kind of one of the hazards of being a leader of a health department. But by the end of the journey, that phrase had been totally eliminated, and it was a real collaborative sense of pride and accomplishment that we were able to, as a small health department, actually, do this. I call this sort of the SOL, approach to accreditation. That means various things depending on what tavern you're in Wisconsin on various nights. But for me, the S part of the whole process is selling it. And, if you've ever done the Strength Finders assessment, how many in the room have ever done Strength Finders? I see some hands going up. You have to start being concerned when your boss has like achiever and strategic and influencer traits. And unfortunately, those were my top 3, so kind of the rest is history. But we kept telling our staff that, hey, look, folks, we think we're a darn good health department. Let's go out and prove it. And learning and applying performance management and quality improvement can only make Polk County Health Department better and stronger. We're great at plans, strategic planning, public health preparedness planning. We live community partnerships. And the things that we really don't have in place right now are probably things that we really need to work on regardless. And that was certainly a highlight of how our staff got buy-in. Now, to the board, it was kind of a different story. I'm lucky to have a good board of health, and even as they change every 2 years, I think there's a pride in the Polk County Health Department with our board members. And we sold it to the board in terms of the potential of edges and grant funding down the road, and being able to tell the public, we're an accredited health department. This means that the citizens of Polk County are really getting quality services. And as the last statement says, it's not easy being in government these days. We need all the positive press we can get. And if no other rationale really fit, this one kind of did the trick for the rest of those non-believers. Big party, shiny plaque. So we did the, selling it. That's the S part of the SOL. And the O part is getting organized. And truthfully, I think public health people are usually the most organized people in the entire universe. So it's convening that team. We had a team of myself and 3 health educators. We brought in other leaders throughout our process, and mostly program experts in our department. And we have an ongoing leaders group with our program managers and other supervisors that meets monthly, and everything was vetted through them. So that organization structure seemed to work for us. We did a self-assessment. In fact, we did a couple of them. We subjected ourselves to more pressure than we probably needed to. But those self-assessments really helped us identify what was missing and things we needed to work on. And the big 3 with the strategic plan, Shaw and Chip, we've done those, as Nancy alluded to, in Wisconsin for many years. So that was a process that was firmly entrenched in our community and something that we had a pretty good control over. This is kind of how you feel when you start doing this, that you'd like to take that computer and sort of throw it out the window. But once you looked at the big things that you didn't have done, and for us those were big things like a comprehensive communications plan, a comprehensive performance management plan, a workforce development plan, and how we were going to assess workforce competency. We knew what work was cut out for us, and we knew how to move forward with those things early on in our process so that we could really start eventually collecting that evidence that we needed. We had an internal database. I think all of you who are in the process or who are accredited out there know that organizing your work and your evidence electronically internally is a big factor in your success. And we created electronic folders for each of our domains. We had subfolders. We kind of lived in that little electronic world for, a long time. And we had a little nice slush folder when we would gather evidence that we knew was good stuff, but we weren't quite sure where to put it. So we called it our slush folder, and we used that down the road to pull out things that were pertinent to the domains. Schedule a domain a month, week on the calendar. You sort of have to force yourself to do this kind of stuff. It's sometimes very tedious and not fun, but we took calendar and X'd out days where we just would not take phone calls, we put a note on the door, you can't come in here. We're really working on our accreditation evidence submission. And along the way, of course, we're educating the board members, we're educating staff, we're having off-staff meetings, we're going out in the community and talking to our partners about what this accreditation stuff is all about. So it's a process. Set up a timeline that really makes sense for you. And for us, it was a 3-year approach, where in the first year we were doing our self-assessments, kind of planning our internal electronic structure. Second year, making sure some of those big things were done and done well that I spoke of earlier. And finally, the last year was primarily collecting and uploading evidence and educating boards and staff about things that were missing, still needed to be done, what we could collect. Lessons learned, this is stressful. You need little kind of stress reduction periods. This was one, suggestion someone uploaded to us. And then get to the L part of the SOL approach. And for us, to me, the biggest lesson learned is this process is so long and so ongoing that leadership is critical. And as the health officer, you're the one that kind of all of that responsibility falls on. But you need to inspire staff. You need to guide and support them through the process and build them up when they're feeling like, are we ever going to be done with this? Constant education is key. Partnerships that you've nurtured throughout the years as health departments really pay off in the end. And it's important to keep them in the loop and to cultivate those relationships. Written plans, I think many of us are experts at written plans. For those of you who are accredited or on your journey, you have to live those plans. They can't just be sitting on your shelves. So making sure that when you design your plans, they're doable, they're achievable, they're measurable. You learn all kinds of things about how good or bad your documentation is during this process, and we certainly had our ups and downs with it too. But believe me now, we know about signing, dating, letterhead, all the comprehensive stuff you need to do when you're creating evidence. And a final little tip is get a scanner. You need a scanner. Get an email archive program. So, we do so much communication by email right now, and it is so helpful to go into a software program that can dig up emails from a year and a half ago that are relevant to one of the domains and measures. You got to expect some setbacks, and, things don't always go as smoothly as expected, but here's where that leadership is so important for you to come in and build up your staff and pat them on the back and encourage them to keep going. Nobody's perfect. It's all about the journey and the experience, and in Wisconsin, we really work hard, but we know how to have fun along the way, and the same thing at Polk County Health Department. We took a lot of time to laugh at ourselves and to enjoy the process, and there's still a lot of fond memories of our 3-year accreditation journey. Finally, this is achievable. We're a small health department. We're a county of 45,000 people. We organized ourselves to do this. We got it done. We're accredited, and so if we can do it, you can do it. So dream big. This can happen for you. Thank you.
Thank you, Gretchen, for that wonderful PowerPoint. I am going to talk a little bit about first WALDAB, our Wisconsin Area Local Health Departments and Board, as immediate past president, and then I'm going to talk a little bit about our journey towards accreditation. And I'll probably refer to Gretchen quite a bit because as a leader in Wisconsin, she certainly has helped my health department move forward. As immediate past president, I'd like to take a few minutes just to talk about WALDAB. And WALDAB is Wisconsin Area Local Health Departments and Board, and the membership is comprised of health officers and board members. And I think that's very important because that is a key partnership in the state of Wisconsin to have our board members working with our local health officers in all matters of public health, not just accreditation, but in our day-to-day activities that we do as local health departments. So as WALDAB is as we move for accreditation with WALDAB, one of the key roles that WALDAB has is supporting our efforts. And with our multi-state learning collaborative, which Nancy and her group led, the WALDAB board directors approved the partnership in the application. And that's just one way that they support us as we are moving forward in our efforts for quality improvement and accreditation. The regional WALDAB groups also meet, usually on a monthly or every other month basis, and they are the avenue that people come to in the state of Wisconsin to talk about things that we want to move forward. So what we did with the Learning Collaborative is we went out to each of the WALDAB groups and we talked about accreditation, we talked about quality improvement, and we talked about what this is going to do for public health in Wisconsin. We were able to recruit local health departments and tribes for each project year of the collaborative. And I think one of the important things that I'll talk about later is being involved in that multi-state collaborative and being involved with the local health departments really helped us move forward. WALDAB also supports accreditation through looking for grant funding. And one of the grants that they had received, the first one, it's actually the second bullet point, is a community health improvement planning project. And what they did is they wrote the grant to develop tools to assist local health departments in their CHIP process for community needs assessments and for CHIP planning. The second grant that they received is the County Health Rankings Action Funding, and this is to increase local support of and engagement in community health efforts. It really builds upon that first grant to look at the tools to help local health departments implement their CHA and CHIP. In addition to that, the state of Wisconsin looked at regional design of their 5 divisional public health regional offices. And WALDAB was essential in that process, leading the discussions with DPH, reassuring that we have support from our regional offices. And one of the things that we looked at was assurance that we would have that support in the things that we needed for accreditation. Things like our CHA, our CHIP, strategic planning, quality improvement, and performance management. That was really important to us because as the state of Wisconsin, moving forward with accreditation, we wanted to make sure that our regional offices had the support that could be given to us to move forward with all of these main strategic parts of accreditation. So moving on to my other hat as a local health officer, this is the state of Wisconsin, and Oneida County is the red star up top. And we are very rural and small. Our largest city is 9,000 people. We have 2 smaller townships. We are 96% Caucasian, and as we move through the accreditation process and some of those domains with cultural competency, the 96% Caucasian did cause us a little bit of struggles in those domains. We are increasing in diversity. I think when I first started, we were 98% Caucasian, so we are increasing. Mainly it's the food industry that we are seeing the diversity. And we also are an aging population. So our main population base is 50 to 59-year-olds. And just like Gretchen, our journey towards accreditation, it was, where do we start? How are we going to do this? And I can remember talking to my fellow health officers saying, what is this? We have a community health plan, and now we have this QI plan, and a strategic plan. How many more plans are we going to have? And where do we stop, and how do they fit together? Well, I would just like to highlight some steps that we took towards accreditation. And again, in 2008, YQI, which was our multi-learning collaborative, and Nancy is really where I give credit to the start of our process for moving towards accreditation. In 2008, that is when we learned about QI, and we learned about strategic planning, and we learned about all of those things. So in 2010, we had our first QI plan was developed, and that was in no part due to other health departments. I will say that we looked at a lot of QI plans across the nation and utilized those resources as we built our first QI plan. In 2011, we were due for our community needs assessment, which we do every 5 years in our community. and we did our community needs assessment and our plan. In 2011, we updated our strategic plan, and again, you can see these are the big documents that you are going to need to move towards accreditation. In 2011, we had our performance management plan, and again, this was something that we had said, what is performance management and why do we need another plan? In our health department, we really viewed performance management as the umbrella. It is something that we feel everything falls under, and our strategic plan, our quality improvement plan, our objectives, everything really is based now under our performance management plan. In 2012, we updated, again, review, revise, date, update. We reviewed and updated all of our plans, and then we implemented the core competencies into our annual evaluations and into our job descriptions. And then we just recently hit the submit button. We are in the process of going through the timeline now for accreditation. I want to talk just a little bit about the importance of Board of Health and the importance of getting your Board of Health members on board for accreditation early on. And one of the things that this screen just shows is on the right, on the right is minutes from our Board of Health meeting. I have highlighted, and this is actually two documents that I uploaded for accreditation, and I highlighted the portion on the right in the minutes to let the site reviewers know what evidence I'm uploading. And what that says is, here's our accreditation update. Board of Health, it's on our monthly agenda. You will always hear about accreditation and where we're at in the process. And on the left is a document that identifies all the things that the Board of Health members have done over the last year. And this is another document that we uploaded for accreditation. And it just says, well, here's the legislation update. Here are the things that you've done. Here are the resolutions. Here are the reports and plans that you've either reviewed and okayed. Here are the program updates. So this was a very good document that let the Board of Health members see what they have done in the last year, and they have done a lot. So I want to just show a short video, I hope. Okay, maybe. Hopefully I'll show a short video. We have two ways of getting it up, and neither are working. Mm-hmm.
I think that people worry because they think it's going to cost a lot of money, it's going to take a lot of staff time, and we're not going to end up with anything. But I think that's just people's resistance to change, and I think the pros definitely outweigh the cons, because I believe that our health department will be living up to a national standard of excellence that can be measured and compared to any place else. And I believe that gives the public and the Public Health Board more confidence in how well our Public Health Department is protecting our health.
I have the utmost admiration for our department staff that is currently undergoing the process, simply because, to me, it is going to enhance our image within the community, and we are going to be able to assure them that we're providing quality services, that leadership is being developed, that the services are being accountable, that education is an ongoing, integral part of the Oneida County Health Department. So I see that as all positive outcomes of the accreditation. Right now, our accreditation is funded through grants. That, if you think ahead, may be an issue in the future. If those grant possibilities are not there, then we need to figure out how are we going to continue this, because truly as a board member I feel it's an absolute necessity for our health department.
I believe our staff enjoys the challenge, of proving, hey, politicians, city government, community at large, we really provide extremely high quality of service. And this is our way of, showing it.
One of the reasons why I chose to show that video is because I think it's important that Board of Health members understand and realize why you're moving forward in accreditation, and they're key in their support for us to move forward. Without their support, we will not be able to get future funding. We will not be able to get the community behind us, and so Board of Health members really are key. And that video, Oneida County, La Crosse County, and West Dallas, and we had done a video previously with other Board of Health members, I think from Wood and Polk County. So you can see with the health departments that are moving forward in accreditation how important that support is for board members. And now let's hope that I can get back to my slideshow. All right. So finally, I would just like to talk about our future and quickly go over, because I think my time's probably about up. We really want to concentrate on workforce development. Even though we've hit the submit button, we all realize, again, we are not perfect and we need to work on things. And workforce development is one of the areas that we truly want to work on. And we want to continue with our performance management tracking. And as part of our QI process and our QI culture, we have implemented a new team in 2013 to assure that all of our staff have been members of the QI team, and we have built a QI culture in our department. Leadership team, it's brand new for our department. We have 18 staff, and so a leadership team is pretty small, but we're looking at them to be taking on more responsibilities. And our accreditation coordinator is in charge of monitoring all of those plans that I talked about. And again, implementing the necessary changes as a result of our accreditation site visit. We will continue to update on accreditation and QI staff. So with that, I will hand it over to Lorrie. Thank you.
Bonjour. Hello, I'm Lorrie Shepard with the Forest County Potawatomi Tribal Community. Our tribal community is located up in northeastern Wisconsin. We have approximately 725 Potawatomi tribal members that reside on or near our reservation. Our community health department is made up of 13 staff. We have community health nurses, community health representatives, a health educator, and a dietitian on staff. And I've been asked to talk about some of the reasons why we have chose to take this journey to accreditation and some of the successes and challenges that we've encountered along the way. Oh, there's my slide, sorry. So some of the reasons that we're striving for accreditation. First and foremost, the devotion to our community and our tribal members. We desire to provide quality health services that meet the needs of our tribal members. So that is first and foremost the most important thing to all of the staff at our facility. Recognition. Our tribal health department, we want to be held at the same level as the local public health departments and the same standards. We want to be able to strengthen our internal and external partnerships. We find it as an opportunity to work together with other departments and organizations so that we can expand our programming to our community members. It's an opportunity for growth and development, not only for our programming, but also for our staff. It's an opportunity to look at our strengths and our weaknesses and to determine those gaps and areas that we can improve in. We found that public health accreditation the standards are in alignment with our AAAHC accreditation. As Linda Helmlick stated earlier, our facility has been accredited by AAAHC, the Accreditation Association for Ambulatory Healthcare, which focuses mainly on the clinical aspects. So we found that a lot of the standards and things that we needed to do for AAAHC align with the FAB standards. Support from our leadership in our community. Our leadership is very progressive, and they like to want to see us continue moving forward and improve our services and programs that we provide to our tribal members. Encouragement and support from regional and state organizations. We were first approached by our Northern Regional Office, Terry Timmers, 3 years ago, who felt that she saw in our department that we could achieve this, and she encouraged us to join Nancy's group and to take this journey. So we are grateful to those folks in what they do to help us and have done and continue to help us to achieve this or take this this journey. We've also been lucky to receive the CDC Infrastructure Quality Improvement Grants for the past 3 years, which has helped us tremendously fund and support our programming. And again, number one, our community's health is important to all of us. So some of our successes that we've seen so far, awareness of our community health needs. We've had to do the CHA, which is something we've not really done in the past. So we've been able to focus on the needs of our community, and it's reminded us to stay community-centered, that the services that we provide are the services that our community needs and wants. It's also given us direction to what our focuses should be in the future, and our events and programs now align with our focus areas that were determined through our CHA. The changes in the way that we work and think, it's no longer acceptable to just continue doing what we're doing for the sake of doing it. It's essential that we evaluate our programs and ensure that what we're doing is effective. Continual improvement is our focus as well. Quality culture, QI has become embedded in our day-to-day work ethics through evaluations, QI studies, and strategic program development. We've established systems for measuring our successes. We're using indicators and measures, or indicators to measure the effectiveness of our programs and services, something that we've really never done in the past. With this information, we've been able to determine our gaps, and it's given us direction in what we need to put more efforts in. Community-centered programs and services. We've acknowledged that we need to be aligning what we do with our community's needs. And then enhancement of programs and services through best practices. We're utilizing best practices now and continually assess the quality of our programs to determine what we can do better in the future. Expansion of internal and external partners. Working toward accreditation has allowed us to expand our partnerships and identify ways that we can work together. We feel this is important to have input from a variety of stakeholders with different areas of expertise throughout our community health improvement planning process. Collaborative tribal networks. With Nancy's help and the YQI program, the Wisconsin Public Health Quality Initiative, we've been able to meet quarterly as a group with other tribes throughout Wisconsin who are also pursuing accreditation. It's been beneficial for all of us to share our experiences and our challenges throughout this journey. And it's been helpful to work with others who understand tribal dynamics and our uniquenesses. And our community has a voice. The CHA has allowed the community to tell us their story and what they need from us. We've also tried to engage our community members throughout this improvement process. It's their future, and it's important to to us that they have input in how we help them with their health care. And our challenges. They have been many, but we're working to get through them. Aligning FAB requirements with our tribal values. Each tribe is different, and what is acceptable to share with others varies among tribes. There have been challenges with accessing tribal data and concerns about who we share that information with. Accessing the Forest County Potawatomi tribal-specific data has been a huge challenge. Our community is we're located in a county that has another tribe in it, and really drilling down to tribal data that is specific to Forest County Potawatomi is pretty much non-existent. Tribal member involvement and participation. We feel it is important to involve our tribal members in our improvement planning process, and getting them and keeping them motivated and involved has been challenging. This has been a relatively new process for tribes, developing the CHA, the CHIP, and the strategic plans. We've always been included in our county's CHA and CHIP, and now that we're creating our own, it's been difficult to find templates and things like that to help us and to use as guides. We have lack of staff who see value in accreditation, but we're working on that. Keeping them engaged and accountable and motivated has been challenging. It's proven, but by inviting staff to our committee meetings, keeping them involved, keeping them updated on progress and why this is important to us, we're hoping to gain more support from our staff. And finally, finding time. This is a big job, and putting it as a priority, working with our staff to make sure that they keep striving for accreditation and helping us along the way. You know, there's a lot to do and a little time to do it. So hopefully our plan is that we will be putting in our letter of intent by the end of this year. And yes, I did say that, Linda. She's recording, so. But we've been on this journey since 2010, and so we're hopeful that soon we'll be able to complete our journey. But obviously, you all know it's not, it's a never-ending journey, so thank you.
Good morning. I'm Angela Nimsgern, Northern Region Director for the Office of Policy and Practice Alignment within the Division of Public Health in the Wisconsin Department of Health Services. Others that you've already heard from have mentioned the close partnership between the state health department and the local organizations that are kind of following along here. I want to say that I'm just one of many working with the Department of Health Services that could be up here sharing our story. And while I appreciate this opportunity, I also want to recognize the vision and the work of my colleagues who I have the opportunity to share today. So a little perspective, the Wisconsin Department of Health Services has about 6,000 FTEs and about 7 divisions. Within that, the Division of Public Health has about 400 FTEs. And we have 6 bureaus working in communicable disease and preparedness and maternal and child health, and then our Office of Policy and Practice Alignment. The highlights of our story with accreditation link strongly with those of local and tribal health departments across the state. And we too were involved with the Multi-State Learning Collaborative and other initiatives that you've already heard about. In the summer of 2010, we applied for and were awarded a National Public Health Improvement Initiative grant. And as many of you know, these were 5-year awards, projects funded through CDC. Our work focuses on training and integrating quality improvement, performance management, and accreditation readiness into our division, as well as integrating it with our partners. We're also working to strengthen our measurement and documentation related to initiatives with our Community Health Improvement Plan, our State Health Plan, Healthiest Wisconsin 2020. Key to all of this is close connections, frequent communication, and collaboration, both to support our project goals, but also their goals and their work towards accreditation readiness. Just briefly, the Wisconsin Public Health Improvement Initiative goals are to increase capacity and infrastructure within our system, to expand the use of evidence-based and best practices, to improve data collection and use, developing performance indicators, and, of course, to support accreditation. One of the early commitments made by the division and underlying almost everything that our project is engaged in is the idea of spreading resources. Public health systems are rarely fortunate enough to have abundant resources to do the work that we see needs to be done. As written into our initial funding application and continuing commitment is to portion off some of this national CDC award to go to our partner agencies in the public health system. Over the past 3 years of funding, almost 1/3 has gone to local and tribal health departments to support their journey in accreditation. This has been through annual competitive performance improvement and management grants awarded to about 30 health departments and tribal agencies each year at levels anywhere from $3,000 to $15,000 each, depending on the level of work and if they're in a planning mode or implementation mode. Also, the activities of the division have supported the local and tribal partners. We sought experts to provide web-based training and meaningful communities of practice in each of our 5 regions to allow networking and interaction around quality improvement, performance management, and accreditation work being done. The plan is for these to be those opportunities, as was shared, that sharing amongst each other, swapping plans, seeing what others have learned, what meetings they've gone to, what they've picked up along the way. In addition to the 1/3 of the funding being awarded to the local and tribal agencies, about 25% of the total is contracted out to partner agencies, such as the Institute for Wisconsin's Health, to support training and consultation for local and tribal staff. Also funded is the University of Wisconsin to support performance measurement and some integrated data projects. About 15% of the Wisconsin Public Health Improvement Initiative funding supports the 5 Wisconsin Division of Public Health regional offices, who in turn then support the public health system and the local and tribal agencies within their regions. One of the activities that is supported by the regions is an annual survey to assess the intentions and the progress of local and tribal health departments toward accreditation readiness and their intent to apply. Nancy already mentioned the preliminary results from this year's survey showing that of the 77 respondents, and again we have about 88 local health departments and 11 tribes, but 8% of the respondents have applied or have their letter of intent or application in, and about 20% intend to apply by 2015. So we're really proud of that work. Besides asking about the intent to apply, the survey asks about progress towards implementation of key mileposts towards accreditation, such as the percent with completed strategic plans, community health improvement plans, QI plans, and performance management plans. So as you can see, huge strides by local and tribal health departments in developing and operationalizing these plans between 2011 and 2013. Agencies reporting that they have completed and implemented a strategic plan rose from 19% in 2011 to 44% in 2013 survey preliminary results. The QI plan you see increased from 8% up to 25%, and a performance management plan from 4% to 16% having one of those implemented in the state. I believe, don't want to take credit, but I believe some of that community of practice, the funding, we talked about the grant funding being important to at least kickstarting agencies. These advancements are due to that sharing and collaborative networks. Linda mentioned the work of the Wisconsin Association of Local Health Departments and Boards in guiding the redesign of our DPH regional offices. The Office of Policy and Practice Alignment staff are core to this, and in 2012 and now operationalizing in 2013, we've established what we're calling radar teams. They're regional assessment, policy development, assurance, and response teams in each of the 5 regions. That's a core of 4 staff in each region that are, as you see from the name, delivering from the core functions of public health to increase efficiency and focus on capacity improvement. Our general core functions for the radar teams are to assure all local health departments provide the minimum set of standards and meet required state statute and rule, that we have an effective and efficient public health system. We're providing consistent, effective implementation of the Department of Health Services policies and programs that align with the local needs as well, and being sort of the ambassador between the State Department of Health Services and the local home rule requirements and challenges that our agencies are facing. So, where is the state in its ambitions to become accredited? As you heard, Wisconsin Department of Health Services has about 6,000 FTEs. It's not, the Division of Public Health is not a standalone department as it is in many states, so rather this organizational structure will present a few challenges to us as we move forward for FAB accreditation, especially in the area of governance and policy influence. But we are not the only one with this challenge, and we don't use it as a barrier. We're looking at it as an opportunity to kind of spread the knowledge and spread the opportunities. As background, I mentioned the State Health Plan, Healthiest Wisconsin 2020, is our statewide community health improvement plan. It was built with input from hundreds of partners across the state. In it, public health capacity and quality is identified as one of 8 infrastructure focus areas. And building a strong public health system with clear expectations of standards was recognized as critical, not just by the department, but also by our partners at the table. The health of the public is essential, and there's 2 objectives with this, that by 2020, all Wisconsin health departments will implement QI processes, and by 2020, all Wisconsin health departments will be accredited using established standards. To support this, the State Department has committed financial support, built the radar teams, and has been analyzing the historical process of classifying local health departments as being a level 1, level 2, or level 3, depending on several factors, including the comprehensive implementation of the 10 essential health services. Nancy mentioned that a little bit earlier as well. So with our journey towards accreditation, we did complete a FAB self-assessment back in 2012 and followed that by development of our strategic plan. We have contracted with an accreditation advisor who happens to have previously been a manager within our division and is also a FAB accreditation site visitor. We've hired some staff to support the effort and are using the self-assessment results and evaluation. We're presenting those to our Division of Public Health accreditation leadership team at the end of this month, and we'll be taking some action later this year and putting together a plan to fill any gaps and move forward with that. Meanwhile, we're transforming the way we do business to focus on continuous quality improvement, but it's a journey, and our development will require collaboration, continuing work, and dedication. We are really looking forward to continuing it and the close connections with our partners that I share the podium with today. Nancy?
Thank you, Gretchen, Linda, Lorrie, and Angela. Jennifer, we have about 10 minutes left, is that correct? All right. So we would love to have you ask some questions of our panel. If there are any, I think there are 1 or 2 microphones available to you. And Jennifer?
While folks are thinking about your questions, I'd like to start us off with one, if I can. And that is, I'd love to hear from you all a little bit more about how the collaboration has accelerated your efforts. And so it's very clear that, you know, all hands are on deck, all parties are working together, but I'd love to hear why that is the best approach.
Can I just pull this one?
Testing. Okay. In Wisconsin, we have a really strong network of local health departments and tribes, and I think the smallness of our local health departments, we have organized into the regional structure from the Division of Public Health standpoint, and we have monthly regional meetings with all health officers in our regions where we talk about joint issues. We give organizational reports from organizations we belong to, such as the Institute for Wisconsin's Health, Wisconsin Public Health Association, Wisconsin Association of Local Health Departments and Boards. So there is an ongoing conversation statewide among health officers and affiliate organizations. The Multi-State Learning Collaborative, I think, was a real kickstart, though, to accelerate the work that all of us were going to get involved with performance management, quality improvement, and accreditation readiness. And the Institute for Wisconsin's Health, along with the Division of Public Health, I think spurred us to act. Plus, we're also dang competitive. And and personally, you know, in our strategic plan, one of our goals was to be the first health department in Wisconsin to be accredited. Well, gosh darn, West Allis and Wood County had that same goal, I think. So there was that competitive drive to see who could do it first. So all in good-natured spirit, of course. But I think there is that natural willingness and drive to really be the best we can be in Wisconsin.
And just very quickly, in addition to that, the state leadership groups, WALDAB, WPHA, DPH, they all are very supportive and also have great leaders that go out and seek grant dollars and seek ways to support local health departments. And historically, they have done that many, many years. And when accreditation came along, QI and performance management, the whole state of Wisconsin just grasped on and just wanted to move forward. And with those state agencies, institutes, UW Population Health, all the larger organizations in the state of Wisconsin are also moving towards the same goal, and we all are moving towards the same goal, which makes collaboration easy.
And as far as the tribes, we meet quarterly with other tribes in Wisconsin who are pursuing accreditation. And as Gretchen spoke of a friendly competition, the Ho-Chunks will not be accredited before the Potawatomi. So.
I don't know that I have much to add to those words. Just one thought from some previous colleague of, you know, if you want to go there fast, go alone, but if you want to go far, go with friends. So.
And here we thought it was collaboration that was the key, and it's competition.
Good morning. I'm Marnie Mason, and I want to first of all congratulate and commend you on your wonderful achievement with 3 health departments being accredited. I'm just wondering, as part of your collaboration, we know for quality improvement, one of the best strategies is to steal from each other. Do you have a website where you're starting to collect the wonderful documentation that you're submitting? And if you do have a website where you're building this compendium of good examples of documentation, is there some way we could all get the website and start to steal that from you? Thank you.
Well, early on, actually, Polk County was awarded one of our grants to develop a Google site, which was PHA Wisconsin. It was framed around each of the domains to begin kind of populating and loading sample documents and words of wisdom. And
we are just in the very early stages of thinking about advancing that to a SharePoint site to move that into something new. But we do have that. I'm not sure. I'll need to kind of check about making that publicly shared through the Institute, but that certainly is a possibility.
You know, our Institute website has some documentation, but doesn't achieve what you were talking about, Marnie. The FAW website was initially intended for that purpose. It needs updating. It needs re-examination. But if that happens, I think it'll be a very powerful tool. You're right, and everybody up here is shaking their head. It does bring up a point I wanted to make very briefly, and that is how generous these early these leaders have been with their time and their documentation. West Dallas, Wood County, and Polk County, but also those just right in that wave behind. And I'm sure that's the case in your states too, that these folks are not where they are by accident. They are generous with one another, and that's a key.
Hi. Oh, sorry. Did I? Okay. I'm Julie Willems-Van Dyke from the University of Wisconsin Population Health Institute. Linda, the comment you made I've heard all over the nation as a challenge with accreditation, which is it's plans and plans and plans and plans. And I appreciate the comment, Gretchen, that you made about it's also about putting those plans into action. And so I'd love to hear a little bit more from you about, what's your secret success around how we do move the plans into action.
I think one of the key components is having number one commitment from your staff, because obviously your front workers are the ones that are putting plans into action, having support with your community, and having support of your Board of Health are all key factors in moving those plans forward. And then, of course, leadership. Plans cannot sit on the shelf. It's very important that you make workable plans, doable objectives, goals, you get excitement behind those plans, and you implement those plans. It's important that you don't just have them sit on the shelf. You have to implement them, and we talk about them all the time during staff meetings, during Board of Health meetings, during leadership meetings. We are reviewing all of our objectives, we're reviewing all of our plans and our measures, and we're asking staff, how are we doing? Where are we at? Do we need a QI project? How can we improve? And just by virtue of bringing it up and getting everybody on board, we're able to get momentum and implement all of those plans. Not easy, but it can be done.
I would echo what Linda said, and believe me, there are ups and downs with plan implementation, and I'd be a liar if I said, that we perfectly implement all of our plans, because you know what it's like with capacity in local health departments and in state health departments these days. People are stretched, and time to really seriously look at plans is, at a premium. The way we've tried to approach this in Polk County is through I referenced in my previous presentation, we call it our leaders group. And this is our program managers and our supervisors, and we have a standing monthly meeting, and our strategic plan is a standing agenda item. And we have developed 4 oversight teams that work on the various goals within the strategic plan, and those teams have their own work plans around plan implementation, where many of our line staff are involved in those work groups. So that has been one way for us to keep sort of tabs and keep that in front of our faces in terms of implementing that strategic plan internally. For our CHIP, that's a whole nother story, because then we're relying on community partners to help us implement that plan. And the way we've addressed that in our county is by assigning major CHIP plans to coalitions that are already actively working on those areas. So for instance, obesity prevention. We have a nutrition and physical activity coalition whose charge it is to be the oversight body for obesity prevention. And for mental health, we have a county mental health task force that has a multidisciplinary group of folks that are in charge of making sure there's implementation of that part of our plan. So we tried to kind of even out the oversight and the implementation responsibilities among partners, as well as the health department having key players on each of those teams. Makes it a little bit more doable. But again, it comes down to what Linda referenced, and that's this leadership. And as the health officer, it's often my responsibility to kind of keep assuring that that plan is still viable and people are paying attention to it.
I think we have time for one more question. I might have seen one. Okay, we've got one back here, and maybe we can get one more. Let's see.
Good morning. I'm Jessica Solomon Fisher from NATCHO, and thank you all for your presentations. I would be remiss in not mentioning that we have a documentation library where we do collect examples from local health departments that are using documentation for accreditation, so I encourage you all to visit that if that is something you're interested in. But my question is, I think, primarily for Angela, and I think that the 2020 goal of all local health departments using QI and being accredited is admirable. And I'm curious as to the receptivity of perhaps some of the health departments that are a little bit further behind and how you're working with them now, or perhaps the Institute, to have them become engaged and interested in wanting to participate in this, I think is something we could all learn from.
It is an ambitious goal. I think, and I guess I'd look to those up here with me as well as how you saw that as a driving force, or it's an ambitious goal, and we had the vision of the Public Health Accreditation Board standards and measures, but we also had others of the national performance standards in mind that folks could strive to. And, it's easy. We're a few years away from 2020 yet. We're moving forward. As we get a little closer towards the end of the decade, we'll kind of see where we're at. I would look possibly to our office director to see, as she's charged also with kind of the leadership, or Karen, who spoke earlier about the ideas of what sorts of momentum we're getting for that goal.
Am I on? Okay. Well, one thing, when that objective was developed for the state health plan, Healthiest Wisconsin 2020, it was carefully worded to say meet accreditation or an accepted standard, as Angela said. Right now, because we do have in statute, as was mentioned earlier, what constitutes criteria for health departments to meet what was a Wisconsin version kind of recognition, and the level of recognition for a health department that does affect some funding allocations. We are in a process now. One of our work activities is to do that crosswalk between the statutes and accreditation to see where, so Gretchen doesn't have to go back through a whole tedious process for that. But additionally, I think in that process we may be asking some questions with input from local health departments in terms of standards if they are not on the track for accreditation. So, we're open as always. We hear from some health departments that, this really will be a challenge.
And I would just like to add that we also have received funding for shared collaboratives, and with smaller health departments, shared collaboration is a key for meeting some of those measures. And again, in the state of Wisconsin, we have a long history of collaboration, and with future funding and future efforts towards shared collaboration, more and more local health departments will start to meet those standards that they maybe can't meet on their own.
That was the point that I was hoping would be made, Linda, that it's a critical thing. Such small agencies, in some cases, they know that the handwriting is on the wall in terms of their ability to achieve accreditation unless they get creative and collaborate with their neighbors. So Reset?
I just have a brief comment. And I just want to acknowledge that there are tribes in 35 states. And I want to commend Wisconsin for their leadership in being inclusive of tribes, because tribes do not have the same level of access to resources for public health performance and accreditation, and are not always at the table in these conversations, even though they want to be. So I want to commend Wisconsin for your leadership and for creating a model for public health system development that is inclusive of local, state, and tribal health departments, because if we are talking about a stronger national public health systems, the tribes must be at the table. So thank you for your leadership and for sharing your experience.
Thank you, Alina. I couldn't even tell it was you. The lights are so bright up here.
All right, I think we need to go ahead and wrap up, but would you join me in thanking our speakers this morning? Thank you for such a wonderful welcome to Wisconsin, and we're excited to continue to learn from you, but we're also excited to learn about what's going on in the rest of the country. And so we're going to take about a 30-minute break, and then we'll start up with some breakout sessions. So please feel free to retire out into the break area.